Well, this story is something worth paying attention to. A silent killer. A deadly fungus is spreading across the world, affecting hospitals and healthcare facilities. And now it's on the rise here in the U.S. But why don't we know more about its presence here? Investigative reporter Jeff Van Sant has the story.
A silent killer is lurking within the walls of some hospitals. Hard to detect and immune to most treatments. It's a super fungus called Candida auris. Found in at least 12 states so far, including places like New York. More than 600 cases this year so far. The Center for Disease and Control say 1/3 have died.
You try to stay one step in front of it if you can.
Dr. Mark Rupp is an infectious diseases specialist at Nebraska Medicine.
Our lab is on high alert to look for this organism.
This highly drug-resistant fungus is mostly found within healthcare facilities.
We use a lot of antibiotics and antifungals, and I think in response to that, this organism has become increasingly resistant to those disinfectants and to those antifungal medications.
It hits patients who are already sick or on antibiotics or attached to a breathing or feeding tube. Symptoms range from feeling tired, low blood pressure, to a fever. While it hasn't been found in Nebraska, you might not even hear about it. The CDC isn't allowed to report on a hospital hit by the fungus. Out of concern, it could create panic, scare people from going to the hospital. Luckily, some facilities like the Med Center are used to dealing with deadly diseases. The hospital cared for 3 people infected with Ebola in this special biocontainment unit.
If we had a patient that we wanted to completely isolate before we brought them into the hospital, this is what we could put them in.
This fungus doesn't call for that high level of isolation, but patients do have to be quarantined. Extra care in disinfecting and wearing protective clothing.
We would very carefully care for a person like this, trying to make sure that we didn't have any spread of the organism.
While the fungus has spread across the world, healthcare facilities like the Nebraska Med Center and the state's top epidemiologists have a battle plan in place. And while the fungus adapts, so does the treatment.
And we will use anti-infectives and antifungal medications judiciously and try to work as hard as we can to make sure it doesn't spread.
Jeff Van Sant, 3 News Now.